All right, welcome back. This week we are reading about burnout. So this is a shorter chapter, but nevertheless an important one. So let's get started. All right, our learning outcomes for this video include identifying symptoms, causes, and the effects that burnout can have on our lives, both professionally and personally. So before we get started, I'd like you to consider this question. How would you know if someone is experiencing burnout? How would you know someone is experiencing burnout? You may have thought they show signs of fatigue or being tired, maybe being irritable, disengaged personally and professionally, or other related descriptors. If you were on that track, you're right? So this slide offers a list of many of the symptoms for you to consider when looking for people who are experiencing burnout, or for looking at whether or not you might be experiencing burnout. We do show symptoms. And so the fact of the matter is, when we experience burnout, of course, we show symptoms, and sometimes the symptoms go unnoticed, either by ourselves, by colleagues, family, friends. Sometimes these symptoms negatively impact our relationships with our colleagues, family, or friends. And when we pay attention and address them, though, we can prevent the burnout from continuing to disrupt our professional and personal lives or get worse. But they do go unnoticed, and when they go unnoticed, this is when that burnout can continue to increase and negatively impact our lives. So additionally, burnout is a psychological symptom or syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. Burnout reduces motivation by causing us to lose interest in our goals, our personal or important relationships, and at performing at our optimal levels in order for us to be successful. So what causes burnout? How is it possible that two people can experience almost the exact same types of situations, and one experience burnout and the other one doesn't experience burnout? Perception, among other things, is at play here, of course. So perception is critical here, just as it is when we talked about stress. When perceived demands increase and perceived resources decrease, so you can follow along here on this chart, then it creates a perceived threat. We know that that perceived threats activate our sympathetic nervous system, the fight, flight, or freeze response. And when this happens all of the time, like in professions like nursing, with police officers, firefighters, EMTs, teachers, etc., right, frontline workers, and many other professions that I haven't listed, it can create chronic anxiety. Okay, so it can create chronic anxiety, which then, of course, can create burnout. Okay. So it is important here to note, with regards to the question that I asked a few moments ago, that while work-related stressors can contribute to burnout, it does not explain why one person will burn out while another person experiencing similar or the same work-related stressors is not in fact affected by the burnout like the other one is. So why is this? Well, we know past experiences shape a person's perception, and we all have unique past experiences. So we perceive events differently, our biology, and then, of course, many other factors can play a role as well. So what are the effects? There are lots of effects. This list here is not comprehensive, but it's still a strong one. And there are many effects that that a person can have, that burnout can have on a person's life. So they can suffer depression, anxiety, or other mental health issues, have poor work performance, which can even lead to additional work-related issues and financial issues, especially if job loss is involved. Burnout can negatively impact relationships with our loved ones, with our close interpersonal family and friends. It can, and that's a lot of the time because we don't have the energy to invest our best selves like we did prior to the burnout. So it can cause an increased use in alcohol and drug use, and cause other physical and mental health issues like we learned about when we were talking about the impact that stress can have on the body and on the brain. It can also cause a person to switch careers. And we saw this a lot during the pandemic with shortages in the healthcare industries, specifically among our nurses. So they continue to be in high demand. So these are just some of the effects that burnout can have. Burnout is real, it has consequences, and it negatively impacts our well-being as well as our livelihood. So now that we have examined the symptoms, causes, and effects of burnout, we will learn more about compassion fatigue in our next week's chapter. So until then, I'd like to leave you with this quote from Viktor Frankl that reads, "When we are no longer able to change a situation, we are challenged to change ourselves." Make it a great week.